de-incentivize physicians. Okay. The end result, okay, is individuals and families will be forced to pay higher premiums for lesser insurance. It's causing doctors will be forced to choose what tests, medicines, and treatments will be implemented based on government choices, not patient needs. Okay. I just want to share with you real quickly, and I don't know how much time I have. Karen never told me how much time. Okay. My story. I've been in this community since '99. And I was part of Southwestern Medical, which is was a large Christian organization here. Lots of Christian docs, and they did a lot of foreign missions. That's what moved me here from Oklahoma. Love Southwestern. Within the past couple of years, they've been forced to integrate with the hospital. But I worked with Southwestern for 3 years. And then really, I felt like they were not implementing the mission statement as I felt like I as a physician needed to. And over a couple of things, I decided that I was going to leave Southwestern, and I worked in the ER for a couple of years. I'm not an ER doc, okay? I'm an internist. I love the continuity of care, so I decided, okay, I'm gonna open up my own clinic. So I opened up my own clinic. We opened up Rafa in 10 years ago. We celebrated our 10 in July. So 10 years ago, I opened up Rafa Medical Center, and I thought I'd be here in the community. 3 years ago, I was invited to come down to Campbell University. Campbell University is a Christian college that has opened up this year a medical school. And they've asked me to become the director of medical education. Man, I fought that, guys. I thought, no. I opened up Rafa. Rafa was my child. I birthed it, okay? And I, went from a small little building, and I built a building, and what am I doing? Lord, are you really, really calling me to North Carolina? And I kept telling Dr. Kaufman, no, I wasn't going to go to North Carolina. But we really need you here. We want you here. He wanted me to teach in whole person care, disaster relief. I do a lot of foreign missions. He wanted me down as the director of medical education. 3 years. 3 years. Dr. Kaufman. Dr. Kaufman. I still have to change my mind. Thanks. You again, Dr. Kaufman? Finally, in January of now going on 2 years ago, I went down to North Carolina at the invitation of Dr. Kaufman and at the encouragement of my practice administrator, and said, you know what, you really might be able to have the students and residents rotate up here, but you ought to go check it out. Well, I went down to North Carolina, and simply put, I was blown away by what Campbell was doing. And my head went swirling. It's like, Lord, could you really be calling North Carolina? But what about my patients? What about my staff? What about? And finally one night, relentless, and I felt that Jacob had nothing over on me with his wrestling with God, because I wrestled with the Lord. And finally I felt like, yes, I was supposed to go down to North Carolina. So it's like, okay, so I had to put a silence to all the whatabouts. So I wrote out the most painstaking letter to my patients and saying I was closing Rafa, and that I'd be leaving the community, but that there would be physicians here that would assume their care, and we were going to be bought. Now, I was offered a buyer for the clinic. So last year at this time of the year, PHS and Unity out of South Bend, they were buying our clinic. And they were going to put 3 physicians in my clinic, and they were going to run specialty clinics, and they were excited. They were excited about what they found, and I was excited because my patients were going to continue to get care. I had the letter of intent. I had the contract. They were buying us. I submitted the contract to the attorneys. They were buying us. Suddenly, at the end of October, beginning of November, I heard nothing from them. And they weren't answering my pages. They weren't answering my phone calls. They weren't answering my emails. So you know when you can't get to anybody else, who do you go to? You go to the secretary, right? So I called the secretary of the big organization and said, I have not been able to get a hold of Dr. Posar, Dr. Allen. Can you tell me what's going on, and can you get a hold of one of them for me? I said, Dr. O'Donnell, I'm sorry. I'll make sure that somebody calls you back. So within 30 minutes, that secretary had Dr. Posar call me. And Dr. Posar said, Sherry, simply put, we never expected Obama to get reelected. We are not buying your clinic. I was like, excuse me? He said, we're not doing primary care. Obamacare is going to be the death of primary care. We are not buying your clinic. I said, but I thought it was done. I have the letter of intent and I have the contracts and I thought it was done. And he said, you do the letter of intent, whatever you feel like you need to do, but we're not buying you. That put me in quite a quandary. And I went to my practice administrator and said, Sandy, we've just been unbought. And she said, now what? And I said, I don't know now what, but I do know that God is a God of responsibility, and I won't just walk out on my patients. So I continued then to look for another buyer. Spectrum came down, Spectrum out of Grand Rapids. They came in, they loved what they saw. Dan Gravengod's exact words was, you have a Lamborghini here. But a Lamborghini without you, the engine, means nothing to us, and we can't find primary care physicians. They passed up the Lamborghini. My commitment, and why I'm still here, number one is because my commitment to my Lord. Secondly, my commitment to my patients. How long will I be here? As long as God allows. And as long as the patients still need care. But I can tell you though, and when I say this, guys, many of you don't know me, but when I say this, please hear my heart. It's not because I'm so wonderful, but because the need is so desperate. Next slide, please. Just skip on to the whole next slide. Okay, if we can open this up, I think this is the real problem. If you can open that up and then hit the hyperlink. No. There's that little video. Okay. As he's doing that, and I'm hoping he's going to be able to do that, if you right click and then open the hyperlink. What I want you, I'm going to give you a little assignment here. I want you to count the number of times, great, I'm going to do it regularly, the number of times that the people in a white t-shirt pass that basketball. Okay? So count the numbers of times that basketball is passed. I'll make it easy. The numbers of times that basketball is passed. Okay? Play it for me, please. Whoops.
Basically, the government wants all the doctors to belong to the government, don't
You got it. That's exactly right.
The answer is 0.
Okay, if you'll go back and then when you open that up, if you hit connect hyperlink, because you had it up.
Yeah, this one's not connected to the internet,
We're not on the internet. Tether that bad boy.
Okay, but you should still be able to get it out of there. That's why I added to. Okay, can you hit the play down there? There we go. To yourself. Okay. How many times has the basketball passed? How many? Okay, 7, 22. Anybody have more than 22?
27.
27? How many do less than 27? How many have?
19.
How many do you have? Who else? How many? 16, 18. Okay, okay. Did anybody see anything else?
Handoffs.
The gorilla. Did anybody see a gorilla? How many of you saw a gorilla? How many of you didn't see a gorilla? Now, we're going to play it again. Yes, there's a gorilla. And there's a gorilla that comes amidst the ball players. But you're going to laugh at yourself because you're going to see the gorilla this time that you didn't 2 minutes ago. Play it again, please.
I'm going to try and get the right number.
I didn't see him walk in, I saw him.
Thank you. And if you pull up to the next slide.
He wasn't there.
He was there before. The same exact video. Okay? The throws are really just a simple diversion. The right answer is 16, so how you said 27 or 20, I don't know. Okay? But that's simply a diversion. But that's what's happening with healthcare. Is the pop terms healthcare for everybody sound so wonderful. Nobody's seeing the gorilla in the room. And the gorilla is there. Right now, the nation has nearly $17 trillion in national debt and is running an annual $1 trillion budget deficits, largely attributed to the existing entitlements. And what are we going to do? We're going to add additional entitlements. Obamacare creates 2 new entitlements projected to cost nearly $1.8 trillion over the next decade. Next slide. New spending. What's happening is there's going to be a massive Medicaid expansion. That's right. Okay? Massive Medicaid. Now, no one ever really wants to have to go on Medicaid. Why? Because it doesn't offer good health care. Okay? So, beginning in 2014, the Affordable Care Act expands Medicaid eligibility to, now look at these prices too, all individuals earning up to 138% of the federal poverty level. This is going to add an additional 13 million Americans to Medicaid, costing the federal taxpayers, you and I, $709 billion. Okay. We're subsidizing to purchase coverage in the government-run exchanges. The other thing that's happening is that Obamacare creates government subsidies to such an individual and families that earn 100% to 400% of the federally poverty level. Okay, 400%. This is the income then. And this is where we're saying, okay, wait, you can be on Medicaid if you make this amount of money. The income ranging from $12,000 to $46,000 for an individual. $46,000 for an individual, that's not bad money. But here, we're going to allow them to get on Medicaid. For a family of 4, up to $94,200. And we're going to allow them to get on Medicaid. No, it doesn't make sense.
Who's going to pay for that? The average income in the state of Michigan is only $43,000. Who's
Yeah.
going to pay for those $94,000 salary people to get their health care for
Well,
free?
we're going to look at some of where the cost and where the income's coming from. But you and I are going to be paying for it. Okay? 19 million people will receive subsidies costing the taxpayers $1 trillion. $1 trillion. Okay, next. Now, new taxes and penalties. This is where some of it's coming from. Okay, I spoke with a patient today that owns a small business here in the community. She has 47 employees. Fairly large. I think I get 6.5. I'd say half because I've got a couple part-timers. But her insurance to cover her employees were $60,000 this past year. Next year, based on the new taxes imposed because she's offering health care. Now, does that seem backwards to begin with? Wait a second, you're going to be penalized because you're offering health care. Okay? She sent over to me the list of taxes that are being imposed upon her. It's going to incur an additional $40,000. So now she just went from $60,000 to $100,000 to offer insurance to her 47 employees.
That comes out of her pocket.
She bet it comes out of her pocket. And the imposition on small businesses is nuts, okay? But the name of some of these taxes? Federal Insurance Premium Tax. This annual tax on the insurance industry provides revenue to the federal government. Tax number 2, Comparative Effectiveness Fee. This annual tax funds the Patient-Centered Outcome Research Institute, the institute I spoke to, that will be deciding how much the doctor is going to be reimbursed and what you're going to be allowed to get with your health care. And this institute compares how well different medical treatments work. Number 3 fee, number 3 tax, is a reinsurance fee. It's a transitional reinsurance program was created to stabilize the cost of insurance during the first year of healthcare reform. The reinsurance fee supports this program. In a second, let's read that again. Okay? It's a reinsurance program that was created to stabilize the cost of insurance, but we're going to tax you so that we stabilize your cost. That's cost. That's right, that we created. Okay? Next, and these are legitimate taxes, guys. This is what her insurance rate went up by $40,000 for. Okay? These are the actual taxes that she sent to me. She said, these are the taxes that we're now going to have to pay. Risk adjustment fee. This fee supports a federal program that compensates health insurance companies that have a less healthy membership. This help keeps the cost of insurance stable. Really? Really? There's 3 or 4 more. You're interested? Come and take a look at these ridiculous taxes. But in our community, one business, 47 employees, their rates have gone up by $40,000. Okay? What happens? The employers say, can't do it. Can't do it. And it's not because they're living high and want to go to the Mexico City and have vacations every winter. They can't do it. So what's happening in our community, and it's happening, employees are getting their hours cut. Now you don't have to cover that employee because they're not full-time. So you are incentivizing physicians and business owners to not insure their employees. Okay, next please. Okay, the new taxation is projected to raise $771 billion in new government revenue. Okay, many of those taxes fall directly on we, the middle class. Now, other fundraising. Other effects the taxpayers indirectly through increased cost of goods, higher insurance premiums, or lost wages. Higher taxation of businesses providing healthcare insurance, and I just gave the story of unfortunate Crystal, increased $40,000. That's 66% increase in 1 year's time because of the Affordable Care Act. I think we should call it a non-affordable care act. Okay? Medicare. Oh, this really gets my attention. Medicare is being said that there's a means of raising income. Right? Another major source of funding for Obamacare reduces Medicare reimbursements by an estimated $760 billion. Now, whether you do new math or old math, Obama math doesn't add up. Okay? Now, if I went into the grocery store and my bill came out to $100, but I looked at them and said, you know what? I'm going to pay you $40 today, Bob.
Wow.
You gonna let me out the store for my groceries? Okay. Medicare right now pays 40 cents on the dollar. Okay? There's another projected 25% decrease. 40 cents on the dollar, another 25% decrease from that. If you do the math, that's now $30 on, or 30 cents on the dollar. $30 for a $100 visit. Now, if I'm going to see Medicare, that means one of 2 things. Either I lose 70% every time I see a Medicare patient, or I have to now see 3 Medicare patients to equal the same compensation that I would 1. Well, if I have to see 3 patients to 1 patient, guess what's going to happen to the quality of time I get to spend with my patient? Okay? So, or I say, I'm not taking Medicare. Go down to the food pantries and get your food for $30. You ain't getting it from this grocery store. And that's what's happening. Okay? So Medicare, their reimbursement is being cut, and they're saying, okay, this is how we're going to fund Obamacare, is we're going to cut reimbursements for Medicare.
Where they're dumping all the people in the Medicare.
Where they're dumping all the people. That's right. So say